ovarian cancer is one of those illnesses with signs and symptoms that can often be mild and be confused with other illnesses. That's why I'm at Cancer Centers of North Carolina talking with Dr. Monica Jones about what women should look out for. So what are the symptoms of ovarian cancer?
Well, for a long time we thought ovarian cancer was silent, but now we know as a result of probably 3 or 4 large studies that women with ovarian cancer commonly present with bloating, feeling full early, gastrointestinal symptoms like constipation, and then sometimes some urinary symptoms. The most important thing is that they'll have these symptoms on more days than not, so 20 to 30 days out of the month, and they'll persist despite treatment of common conditions.
Are there specific risk factors that we should be aware of?
The one consistent risk factor for ovarian cancer is a family history of ovarian cancer. We do see those cancers travel with some breast cancer families as well. We know that mutations in the BRCA1/2 gene, we've heard that from Angelina Jolie.
Yes.
We know that those patients are at risk. Some of the things that protect women from ovarian cancer, the birth control pill has been shown to reduce ovarian cancer by 50% among women that use it for 3 years or longer. So that's been shown to be protective, as is having children.
Dr. Jennifer Rubat is joining me now to share how Cancer Centers of North Carolina treats women with ovarian cancer. Where do you start?
So for most women with ovarian cancer, we usually need to use 2 modalities, meaning they usually need a surgery as well as some chemotherapy after surgery. Women with earlier stages of ovarian cancer, meaning when it's confined to the one ovary, can usually get away with a minimally invasive or robotic surgery that we can use to stage the cancer. And then based on those, on the results from that surgery, we can design a chemotherapy plan for them.
Once a woman is diagnosed with ovarian cancer and is treated, can she go on to live a normal, healthy life, or is there always that risk of it reoccurring?
There's a very high risk of it reoccurring, unfortunately. For most of our patients, we diagnose them in an advanced stage disease. About 70% of the patients will present that way. They'll usually undergo a surgery followed by chemotherapy, and that takes about 6 months for their upfront treatment. Unfortunately, even though 80% of those patients will respond very well to that therapy, almost 60% of them will have the disease come back in about 3 years.
Are there things that a woman can do to maybe improve her chances of it not coming back?
The best and most effective therapy that we've had is to do a very thorough surgery, what we call a cytoreductive surgery, which means removing all the cancer that we can see at the time of surgery. The other modalities that we've used is using chemotherapy inside the belly itself. We'll place a special catheter and use chemotherapy inside the belly in addition to placing it through the IV.
Dr. Rubat, thank you so much.
You're welcome.
You can learn more by visiting the website cancercentersofnc.com.